Coming up next, we're going to be on Health Watch here with the first ever nasal spray to treat migraines approved by the FDA. We're speaking live with a doctor about how this could be a game changer. This could be a game changer. The FDA approving a new fast-acting nasal spray for migraines.
Yeah, so it is the first and the only migraine treatment of its kind that can be offered in a nasal spray. So we have Dr. Payman Sadeghi with the National Headache Institute this morning to talk about that. So good morning for taking the time, because I do get migraines. Can you explain to people, though, the difference between a migraine and just getting a headache?
Good morning, and thank you for having me here. Actually, migraine is a definition which is defined by International Classification of Headache Disorders, and it means that you have a mild to severe headache, which is accompanied by at least a couple of more symptoms, such as nausea, vomiting, sensitivity to light, sensitivity to noise, and among others. But it's a very debilitating and very underestimated condition, as you said. You have it, and I hope you feel better soon. I hope that this medication can work for you.
So talk to us, doctor, about the differences, because right now people may take like an oral medication. How can this nasal spray really help people who may get nauseous when they take pills?
Right. So nausea that you mentioned is one of the big factors, because you cannot swallow anything, much less pills, when you're nauseous. And the other thing is the speed of onset. So we always tell our patients, if you take one thing away from this consult when they come in for a consultation, is to take your medication at the onset of headache. So speed is everything. And this nasal spray gets absorbed in about 10 to 15 minutes. So it's much better than usual 30 to 45 minutes of a pill, of a tablet.
So can I ask you, if you don't get nauseous when you're taking the pills, do you still recommend that you go to the pills first before taking a look at the nasal spray, or it doesn't matter, just go for the nasal spray because it does act quicker?
If you can, it's always best to go for the nasal spray, because it acts much quicker, and you want to get rid of the headache as soon as possible. You don't want to drag it. You don't want to have the headache not even for 15-20 minutes, much less for an hour. So the nasal spray could potentially take away the headache in as little as 20 to 30 minutes, because it acts much quicker.
Wow. And what are we looking at as far as cost goes? Does insurance cover this, or is this an out-of-pocket cost?
Usually when a new drug comes in, the insurance coverage is going to be a little bit stormy, bumpy. They don't want to cover it at first until it's proven or so. But the good news is, I don't know about this drug specifically, they haven't released anything, but the good news is usually when a new drug comes in, the pharmaceutical companies know that insurance coverage is going to be a little difficult. So they're going to have patient assistance program to get patients started, and then while they're working on the insurance coverage on the back end. Okay.
And sometimes dealing with the insurance will give you a migraine. So appreciate that. Well, Dr. Payman Sadeghi with the National Headache Institute. Appreciate you. Thank you.
Well, thank you for having me.